Good afternoon, everyone. Welcome to the Local Educational Agency Medi-Cal Billing Option Program, LEA BOP, Practitioner Enrollment and Medi-Cal Training. My name is Tiffany Lai, and I am a Program Specialist with the LEA BOP Policy and Fiscal Unit. So thank you all for being here today. Our goal for today's training is to provide important updates and guidance on the Practitioner Enrollment Requirement to help ensure that LEAs remain in compliance and continue to access federal funding. Please note the slides for this training were sent out in advance through the LEA BOP listserv earlier today. If you did not receive the slides, please include your name and email in the chat and an analyst will send them to you. We will also be posting it on our website soon. For questions today, you can utilize the chat by clicking on the chat icon as you see on the top of the graphic on the right. This is on your tools bar and a chat window will open on the right side where you can type and submit your questions. You can see the chat window graphic here on the bottom right of the slide. We have a lot of content to cover today and the chat will be monitored by DHCS to answer your questions as they come in. If your questions are not addressed during today's meeting, please send your questions to the LEA inbox and we will get back to you. If we have time left at the end of this training, we will open it up for verbal questions. Also, live captions is available for those who may need it, which you can find in the More icon in your Teams toolbar as shown in the graphic here. Click Language and Speech, which will bring up another pop-up where you can click Show Live Captions. You will be able to view the live captions in the bottom panel of this meeting. Again, thank you all for joining us for the Practitioner Enrollment and Medi-Cal Training. I would like to begin with introductions and acknowledging the teams who we have here today from DHCS. So first we have the Local Educational Agency Medi-Cal Billing Option Program, LEA BOP. And we also have the Provider Enrollment Division, known as PAVE here. They are responsible for the enrollment and re-enrollment for fee-for-service healthcare service providers into Medi-Cal. So thank you all for being here and your continued partnership. So for today's training, our agenda consists of a quick overview of the Practitioner Enrollment Requirement, while most of the time will be focused on the enrollment process of how to enroll your practitioners as an ordering, referring, prescribing, or provider in Medi-Cal through the web-based application, provider application and validation for enrollment, known as PAVE. And lastly, if we have time, we will take verbal questions at the end. So for our first agenda item, we will provide an overview of the Practitioner Enrollment Requirement. In the 2023 School-Based Setting Guide, CMS required practitioners who are eligible to separately enroll as a Medi-Cal provider to be enrolled in Medi-Cal. This applies even if the entity employing or contracting with the practitioner is also an enrolled provider in Medi-Cal. This requirement will be effective July 1st, 2026. And if the practitioner is eligible and not enrolled in Medi-Cal, Medi-Cal payments cannot be made for the service and any expenditures related to the service are not allowable. Practitioners who are ineligible to separately enroll in Medi-Cal will remain a qualified rendering practitioner under LEA BOP. No additional steps are required. You will be able to see the list of eligible practitioner types in the ORP enrollment training in the upcoming slides. In the next slide, I will go over an excerpt from the CMS guide. So here is an excerpt from the CMS guide. The yellow highlighted portion calls out CMS's policy, and the star points out example 1 that CMS provided for this requirement. In the CMS guide, specifically on page 26 through 27, section 3G, the guide states that all eligible practitioners providing direct services must separately enroll in Medi-Cal. regardless of whether the local educational agency employing or contracting with the practitioner is already enrolled in Medi-Cal. So LEA BOP falls under the model in example 1 in the CMS guide, section 3G on page 27. In the next slide, I will go over what's next for this requirement. So what's next? DHCS will be providing additional guidance that includes 1, publishing a policy and procedure letter, 2, releasing guidance and FAQs for this new requirement. And you may ask, when should practitioners start enrolling and what will be their effective date in Medi-Cal? For the enrollment timeline, although this requirement is not effective until fiscal year 2026 through 27, practitioners should start enrolling now. We recommend that eligible practitioners to submit an ordering, referring, prescribing application, known as an ORB application. We will be going over this in the upcoming slides. To help with this timeline, DHCS has provided a survey via eBlast in hopes to help with implementing a phased-in enrollment process to help manage the incoming workload for our partners in DHCS. We are working on developing a timeline to ensure that LEA's practitioners are enrolled timely by July 1st, 2026, so they do not face any financial loss. As of yesterday afternoon, you should have received an email with the survey link. It was sent out through the LEA BOP listserv. If you did not receive it, please email us. We encourage you to complete the survey at your earliest convenience. For the effective date of an ORP provider, when the application is approved, the practitioner will receive the effective date of enrollment of either 1 year retroactive date from the date the application was received, or the effective date of the practitioner's professional license, if it is less than a year from the application receipt date. This is great news and will relieve some stress for LEAs, as their practitioners will be able to apply through June 30th, 2027 and have their Medi-Cal enrollment effective date be June 30th of 2026. Which will be in full compliance with the CMS May 2023 guide. I will now pass it to Brenda Krister from Provider Enrollment Division to present the process of how to enroll your practitioners through PAVE as an ORP provider.
Hi, good afternoon. My name is Brenda Kister, and I'm a section chief with Provider Enrollment Division. And with me today is my branch chief, Vanessa Thomas. And as stated before, if you do have any questions, please put them in the chat so we can provide those answers to you. So to get started in ORP application. So these are the topics we're going to be covering today. So we will go through who needs to enroll, the application requirements, important notes, what happens if you're already enrolled, and the open data portal. Also getting set up in the provider application and validation for enrollment system, which we call PAVE, how to set up your user and profile, also relevant Medi-Cal enrollment requirements, DHCS application review, and additional resources. So who needs to enroll? Only provider type license types eligible to enroll must complete an ORP application. So a full list of eligible provider types is available here. So license types not on this list do not need to submit an application using PAVE. Applications from license types not on the list will be denied. So requirements. The ORP application is for individuals only, so you will be using a type 1 MPI. This application must be submitted from a PAVE profile that belongs to the individual provider and contains only the individual's information. The address used in the application does not need to match the school address. So some important notes. So the ORP application does not include any information about the LEA organization. There is no process to link or affiliate a type 1 MPI to a specific location or LEA program. So what happens if you're already enrolled? So if you're currently enrolled as a Medi-Cal fee-for-service provider with your type 1 MPI, you do not need to submit an application. So no action is needed at this time. So how do we verify if you're already enrolled? So we use an open data portal, the link provided here in blue. So you can verify your Medi-Cal enrollment by visiting the open data portal at the link below. You can select the CSV, Enrolled Medi-Cal Fee-for-Service Providers, to access a searchable spreadsheet where you can filter by legal name and service address, as well as view your enrollment effective date. If a person is on the list of eligible to enroll but not found on this list, you will need to submit an ORP application. So to clarify, you are someone who needs to enroll as an ORP, but you are not on this spreadsheet, you will need to submit an ORP application. Okay, so how do we do that? So to access our PAVE portal, you will select that link on the top left, and this is what the PAVE portal looks like. So you will start by signing up. So there is a sign up process. If you already have a PAVE user, then you can use that. However, if you don't, you will be signing up this way. So you will complete the required information and then select next. You will be prompted to select how you wish to receive a 6-digit verification code. After selecting the preferred option, select next and follow the prompts to complete the verification process. So now that you're set up as a PAVE user, you will create a PAVE profile, which is a workspace where groups or individual providers create applications and manage accounts. A different profile should only be created if there is a different social security number or tax ID number from the existing account. So PAVE user sign up. So ensure you're logged in with your email, your password. You will enter your MPI and select verify. Once the MPI is verified, you enter your PAVE profile name for your legal name and click Create My PAVE Profile. So this is what that workspace looks like. So you do have a tab where you have applications, so you can get started on your application and you can stop if you need to gather documents or information, and it will stay in the applications tab. So if you don't complete it, it will still stay there saved. Also, the accounts is for any applications which have been approved. You will have accounts listed there. You do have a My Tools. So the nice thing about PAVE is anytime you upload any documents, they stay in that document workbench for you. So you're able to use those documents as you complete them. So you upload once and they stay there unless you delete them. And the little arrow on that right side would be that business profile. So you can, it's a little blurry on my image, but that's what states your user profile. So starting an ORP application. In your PAVE profile, you're going to select applications and then select new application. You complete the questionnaire to start the correct application. The following slides will guide you through the questionnaire to start an ORP application. So it's really important at this step that you select the correct fields, because depending on the fields that you select, you will be taken down a different pathway. You do have an option if you realize you selected the wrong fields to hit the previous button and make the corrections. So select the radio button. I'm new to Medi-Cal and I want to create a new application. From the sub-menu, select I'm an individual licensed certified healthcare practitioner. So your business structure. So as you're going through this application, please read the Lucy text. So you will see a lot of Lucy text, which is the little individual on the left side with information. Please make sure to read that as you're going through every slide at any time it pops up, because it does have very important information about the slide that you're on. So select the radio button. I'm an ordering, referring, prescribing provider, or I'm enrolling for a sole purpose of participating in a managed care plan or a specialty mental health services provider, and will be submitting claims for services I provide to counties and or to managed care plans only. So this is what you will select for an ORP. Your MPI. Enter your type 1 MPI, then click verify. So what happens is when you enter your MPI here, you verify it is a correct 10-digit MPI. If you make a mistake, please remove it and then enter it again. So PAVE verifies the MPI with MPES. So check that all the information displayed belongs to you before continuing. If you make any errors keying in your MPI, you can re-enter the MPI and click verify. Once confirmed, you click yes and then continue. So select the provider type. So select your provider type from the drop-down list. If your provider type is listed, you must select that provider type. If your provider type is not listed, ensure that you're eligible to enroll as an ORP, and then select other and type in your provider type. So this is a very important slide. So the following are the only provider types that can enroll as an ORP for an LEA through the PAVE portal. So certified nurse practitioner, licensed physician assistant, licensed audiologist, licensed clinical social worker, licensed marriage and family therapist, licensed psychologist, licensed occupational therapist, licensed physical therapist, licensed optometrist, licensed respiratory care practitioner, and licensed speech language pathologist. So summary page. So you're going to review the summary page to ensure that all of the items selected in the questionnaire are correct. If any updates are needed, please select previous. If the summary page is correct, please select continue to generate the application. So Medi-Cal requirements. So the Medi-Cal program requirements are woven into the application process. So the next two slides will show you who is authorized to sign your Medi-Cal application and the list of required documents that you will need to attach. So who can sign the application? So applications need to be signed under penalty of perjury by the individual who is the sole proprietor, partner, corporate officer, or by an official representative of a government entity or nonprofit organization who has the authority to legally bind the applicant seeking enrollment, or the provider seeking continued enrollment, or the provider seeking enrollment at a new, additional, or change in location as a Medi-Cal provider. Signatures cannot be delegated and must be signed by the provider who is applying as an ORP. So you must sign your application. So some required documents. The slides list documents that you may need to attach to the ORP application. There may be additional required documents. So a valid state-issued ID, a copy of a pocket license or wall certificate for professional license, and if designated as high risk, your LifeScan receipt. So this is what the application looks like, and you start with the individual profile. So you will add your legal name, professional title, date of birth, and email address. LifeScan receipts should be attached for providers subject to high-risk screening. We do have status bubbles in the application, which makes it very user-friendly to know if there's any fields that are missing. So once your information has been completed, you will see a filled-in bubble. If you see any bubbles that are not filled in, as you see here, we have some half bubbles and some that do not have any filling at all. You will need to go back into that section and make sure to complete all of the required questions and also attach any of the required attachments. So to continue with your individual profile, you will add your social security number, government issued ID number, and state of issuance. Provide any aliases, including a maiden name. And just to clarify, we do not accept a passport for this field. It does need to be a state issued ID. Business profile. So list all LEA locations where Medi-Cal beneficiaries receive ordering, referring, prescribing services. Note, the address does not need to match the school address. And as mentioned before, there is no process to link or affiliate the Type 1 MPI to a specific location or LEA program. Next, you will list a contact person. So list a contact person available to answer questions during your business hours. So this could be you, or you can assign a different person who we can contact if there's any questions on your application to answer questions on your behalf. So addresses. Add a mailing address where Medi-Cal can send official correspondence. So summary and the MPI and taxonomy code. This information will be pre-populated from members. You do have a button on the right side to edit the information as well. Disclosure information. Please read each section of the disclosure information and complete as appropriate. Signature. To electronically sign this Medi-Cal application, you must be the applicant listed on the application, and you must be an administrator or manager in the PAVE profile. If everything has been completed, you are now authorized to sign the application. The application can now be submitted. Signatures cannot be delegated and must be signed by the provider who is applying as an ORP and must be under their individual email address. So the enrollment process. So step 1, you confirm you're a provider type required to submit an application. You use the open data portal to confirm any existing enrollment. You complete your application in PAVE portal. Then you submit your application. DHCS reviews and date order received the applications. Note, the legal allowance for the initial review period is 90 days for physicians and 180 days for all other provider types. However, DHCS strives to complete initial reviews much sooner. So correcting deficiencies. So if your application is incomplete, PED will return it to you for corrections. You will be notified via email to log into your PAVE system to fix the noted deficiencies in your application. You will need to go into the application and make the corrections, then resubmit your application to PED within 60 days. Some of the common deficiencies are documents are illegible, or driver's license or state-issued IDs have expired. So please make sure that you do provide a valid driver's license or state-issued ID. Also, if you do not resubmit your application within 60 days, your application is automatically denied. So if approved, referred, or denied, you will be notified via email to log into PAVE system. Click on My Messages tab and view any letters or messages. If your application is approved, your message in PAVE will include an attached approval letter. Additionally, your enrollment record can be found in PAVE by clicking on the Accounts tab. If your application is referred for comprehensive review, your message in PAVE will include an attached letter as well. If your application is denied, your message in PAVE will include an attached letter with the denial reasons and your appeal rights. So additional resources. There's more information on ORP enrollment. Also, additional help with PAVE. So we do have PAVE 101 training slides and additional information on navigating PAVE. If you're submitting an application and experience any technical issues with the PAVE system, you can direct your questions to the help desk, and this is the phone number that's provided here. All right, and with that, that concludes how to enroll in PAVE as an ORP. And at this time, does anybody have any questions? I know there's been some questions in the chat. However, does anybody have any questions?
So there was a couple questions regarding occupational therapists. Are they able to sign their own prescriptions now?
That is not something that I have information for. I can definitely find that resource and provide that to you, but I don't have that information. Ours is specific to just applications.
To bill for services.
Yes.
So they have to be enrolled to bill, correct?
So if it's one of the eligible provider types, they need to enroll as an ORP. Yes, if they're not already actively enrolled.
Okay.
So I guess I was kind of confused. So I know the information we were getting said that our providers have to enroll as Medi-Cal providers through Medi-Cal. If that's the same as enrolling as an ORP?
Yes.
Okay, so it's all one and the same.
Yes.
Okay, thank you.
Of course.
Hello, regarding speech language pathologists, they're hired in my district based on their credential. We don't track their licenses. However, they do hold a license. So are they required to enroll as an ORP or no?
So a licensed speech language pathologist, yes.
Even though my district does not require the license.
So that I don't have an answer to, but I can definitely get that information and provide this. So any questions that I can't answer at this time, we will provide an answer for you later after this presentation. So I'll notate that for you, Ashley, and make sure that I do provide you an answer.
Thank you.
Of course.
Hi, I'm just clarifying. So right now we contract with an ORP and we use his NPI for basically all of our LEA BOP stuff, because that's what we were told to do by our third-party biller. So at this point, it's a requirement for any of our practitioners who have a license to go ahead and get their NPI and their ORP and start using that on their claims.
Yes, if they do order, refer, prescribe, and they're not already currently enrolled and they're one of the provider types listed, yes, they need to provide an ORP application.
Okay, so we're going to move away from having someone else be the ORP for them?
Sorry, I'm
So
not
right-
sure. Yeah, I'm not sure what information was given to you. It's basically what the actual requirement is now.
I don't know if the LEA team wants to touch on that. As far as like the enrollment process, in order to enroll, if you're not already enrolled as a fee-for-service billing provider, there is a pathway for you to enroll as an ORP provider. But as far as, you know, the parameters within your practice, if you're allowed to bill for certain things, you might have to go back to LEA or fiscal to figure out that billing piece.
Up until this point, we were told that we had to use an ORP that we contracted with, and we weren't allowed to use our own NPI for services. So this is a change for us, even though it might have been around for a couple of years. So now all of our licensed practitioners have to, instead of using the ORP we contract with, they now are doing this themselves. And that's the requirement.
Can I jump in? This is Regina with Medi-Cal Claims and Services Branch. This requirement is because of the CMS guidance that we need to be in compliance with as of July 1, 2026. And so it's new for LEA BOP in general. And it's basically not focused on the action of ordering, referring, or prescribing. We are just recommending that folks go through the ORP enrollment process because it's a little bit easier than registering as a direct Medi-Cal provider. But the requirement for the program is that all of the practitioners that have been listed, those who are licensed, do need to be enrolled with Medi-Cal. How you want to function the ordering and referring of services can be something that you determine at your LEA. We're just talking about what we think is probably the easiest way to become compliant with the CMS guidance of becoming enrolled in Medi-Cal. I hope that clears that up.
And just making sure we do have time for a few more questions.
So we have a couple of practitioners that have raised concern having to use their personal Social Security numbers. Is there, I think it seemed like there was other options that they could use other forms of identification. Can you go over what that looks like? And if that's something you've heard other practitioners addressing those similar concerns?
So Social Security is a federal requirement. So it is a requirement to submit the application is to include the Social Security. In regards to the identification, we require a state issued ID. So that could be a state ID or a driver's license. And those would be the two forms of identification that we accept.
So they will have to provide their Social Security number.
Yes.
Yeah, I want to hop on just really fast just to clarify. So the ORP application is for the licensed individual themselves. It's not for the school or the program they're working with. So when you're filling out the application, it's your type 1 MPI, it's your individual legal name, you're providing your driver's license, you're providing your Social Security number, you're signing it yourself. It is for you as an individual. I just wanted to clarify that.
Thank you.
So I have a question regarding the PAVE system and the audit that opens you up to, the site visit audit. We accidentally registered one of our OTs as a PAVE ORP because we couldn't get our services to go through Medi-Cal billing without it about a year ago. That caused a big flurry of activity when they were notified that an audit was going to take place. Do we have any guidance on what we're supposed to have? We had no documentation on what we're supposed to be prepared for. They came out to do a site visit and wanted a bunch of documentation for that just from registering with PAVE.
Yeah, so the on-site visits are conducted by a different division, not provider enrollments. I'll pass it over to Vanessa. I want to make sure I don't say the wrong thing.
Yeah, so just to clarify, audits are conducted regularly. So if there was an audit, there probably was something specific that needed to question the auditor. We don't know what they request, but if an auditor does go out, just provide what you can at that time, and that's sufficient.
Okay, they seemed like they had a checklist of like the name on the door, the hours had to match the application in PAVE, the site address had to match the application in PAVE. All kinds of information that they knew ahead of time. Is there any guidance?
Can you in the chat put your email and we can reach out to you on the side and follow up with you and try to better assist?
Sure, thank you.
My question is, if eligible providers, are they all supposed to be enrolling as an ORP to prove Medi-Cal eligibility? Like, I'm not sure, what is the connection between enrolling through PAVE and being Medi-Cal enroll providers?
So this is the application to become a fee-for-service Medi-Cal provider. So this is the application you would submit, and if approved, then you are an approved fee-for-service provider.
Oh, so they are the same thing. And is this the only way for providers to become Medi-Cal enrolled, or are there other ways?
Yes, so this is the way, and this is the application type that would be used.
Okay.
So there is, if you're already enrolled, we do have other enrollments. So if you're already enrolled, as stated before, you don't need to submit an ORP. But however, if you are not already enrolled, then this would be the application pathway for you to be a fee-for-service Medi-Cal provider.
Okay. And just one more question. If a provider doesn't currently have an NPI number, how long does it take to receive one?
So that's actually a different department. It's not us, and it's through MPES. We can provide that link on the chat as well. That is separate. From my understanding, is fairly quickly, but I also can't tell you how fast. But my understanding is it's pretty fast. It's like an online system.
Oh, okay. Okay.
Yeah, but I just don't know how quickly you'll receive it. But we can put that in the chat as well.
Please do. Thank you so much.
Of course.
My question basically is, our district, we have ORP contracted physicians for mental health treatments, SLPs, OT treatments. So basically my question is, do we still have to enroll our providers when they submit claims for services? And will they be using their own MPI for the claims? Because I'm not sure about, there could be some union issue for, like, their positions. I don't understand. I mean, I don't think that it's part of their job description. And that's why we have contracted physicians that are doing the authorizations and ORP stuff.
Is there anybody on the call that can answer that?
Hi, Marlene, this is Tua. So if I'm understanding your question correctly, it's in regards to billing or submitting claims. And with this requirement, there is going to be no change when it comes to submitting claims. It's just that if the practitioner is eligible to enroll, they're required to separately enroll. So claims, submitting claims should still be the same.
So we're still going to be using our ORP contracted physician?
Are you talking about submitting claims or?
Right. Like, say, for example, mental health treatments, we need authorization from a physician before providing the service for treatments. And so we have a contracted physician who's doing all of this authorization for submitting claims. My question basically for, say, for example, mental health treatments, do we have to enroll still, like, our providers that are, providing the services?
Yes, my understanding is a provider, whether they're contracted or employed by the LEA, if they're eligible or they have a pathway, they'll need to enroll.
So to summarize, that anybody who makes a LEA billing person has to sign up to be a Medi-Cal provider. Doesn't matter if you have a contract ORP, you still have to, if you have a person that is billing under LEA, you have to be enrolled, correct? In Medi-Cal? Whoever bills Medi-Cal should have an NPI number, correct?
Correct.
Okay.
And I think that's what is being discussed right now, because we're having the same issue with having to ask our practitioners to apply for this. It's not something that's in their contract. So we've actually already had a couple of practitioners saying, I'm not comfortable providing my social security number. And is that part of my contract? Do I have to, we're needing to do the same thing, go to the union to find out what can we do to get our practitioners. And it sounds like we're not the only district that's having this, that it's being questioned by their practitioners. That if it's not in their contract, how can we encourage them to continue to participate in an LEA BOP? It's raising a couple of concerns, not only in LEA BOP, but that now also if they don't sign up for this program, how is that going to affect my TSP list? So it's going to affect the SMOP program as well. So we're trying to figure that out as well. I have a question. I don't know if this is something Tua can answer. We're trying to see if there's a stipend. We've actually been asked by a practitioner, is there a stipend for this? For me to fill this out, will we get a stipend? Is this something that LEA BOP funds could be used for, to do a one-time stipend to encourage our practitioners to participate, to sign up? Can LEA funds be used for that?
There is no stipend for this. In regards to if LEA BOP funds can be used for that, I think that will be something that we'll have to look into. And thank you for bringing that up. We can definitely look into that.
And Elizabeth, you can also check with your legal team too to determine if you can use those funds, reimbursement funds, that meet the education code that outlines the reimbursement requirements.
Well, that's what I think we're in knee deep in reaching out to our legal team and reaching out to our union, our unions to find out how we can encourage. Some practitioner types had no problem, doing it. They're very familiar with this and we're very comfortable. But I have to say, we're getting pushback from other practitioner types that have already asked, is there a stipend? And so we're trying to work with, but it would be great if it came from DHCS letting us know. And I think our staff would be, and our collaboration would be very grateful if DHCS could come back and let us know LEA BOP funds can be used, hopefully, to incentivize a one-time incentive to get our practitioners to be able to enroll. Also going forward, we're in talks with human resources. But again, that's the huge thing, to change their job descriptions. This has opened up a huge can for us, huge can of worms.
This is Nicole. I was able to unmute now. We have a question. Is there a difference between the IEP and non-IEP requirements for this? Because certain practitioners were no longer on the list that are eligible to be ORP. Like we have an LEP who currently is an ORP and is signing off for our IEP counseling, but now that they weren't listed in the slide.
Yeah, definitely.
Okay.
So for LEPs and RCSNs, right? So those, previously they were on the list. Right now, those two practitioner types are practitioner types that we are still looking into. And so we'll be providing more information on those two practitioner types as soon as we're able to.
And it doesn't matter what side it's on, if it's on the
Correct.
IEP or non-IEP side. Okay.
That is correct. Thank you.
So I have another question. So on the list, it does mention a certified nurse practitioner, but it doesn't say registered nurse. So our district nurse is a registered nurse. She would not have to go through this process.
No.
Okay. And then will you later be going through the chat and finding questions that weren't answered and emailing us?
Yes, absolutely. So we will go through the chat and make sure anything not answered, we will provide a response. We'll actually send that over to Tiffany to put together and send to her list, her email list.
Okay. And then I'm not sure, I know there was somebody who keeps asking about whether or not once their providers have an ORP, if they no